Dr. Imaza Marion Davis. I practice here at North Shore Medical Center. My office is within the medical office building. I've been there for about 10 years now. I am a podiatrist. Most people, when I say podiatrist, they immediately think pediatric.
Like me?
So I specialize. Yes, exactly. I specialize in the feet, but actually, not only the foot. I do take care of the entire lower leg, and more specifically, I am the director of the Wound Healing Center there at North Shore. So I specialize also in taking care of wounds. With podiatric specialty, we do take care of a lot of diabetics in the community. We also take care of foot and ankle fractures. So our specialty is very diverse in terms of the type of patients that we care for. So today, I was invited to come, talk about this health fair that's going on next Saturday, September 23rd, between 11 a.m. to 3 p.m. The 7th Avenue Medical Healthcare Facility is the one putting the event, and they have gone out over and beyond to ensure that different specialties are there to honor the event and take care of the communities. Me being a podiatrist, they're also going to be a pediatrician, HIV specialist, other primary care physicians, specifically Dr. Joanne Zafar, who is part of the 7th Avenue Medical Clinic. She has multi specialties. She's a pediatrician as well as a HIV specialist. So they're working closely to ensure that we have good representation of all the different doctors who already serve the community and who are interested in being there to help screen patients and answer questions and give them enough information to guide them. We know that after this Hurricane Irma has just passed, that a lot of the healthcare facilities are overcrowded and overwhelmed, and there are a lot of patients out there who are very confused and they don't know where to get help. So this event is a great opportunity for them to come out, because you're going to have everybody in one place ready to cater and get you information and help you with whatever needs.
You will also be at that event. You will be also
Yes.
at that event. And what kind of services would you be offering?
So I will be there at the event along with two other doctors, Dr. Eric Zafrin and Dr. Jamar Graham, podiatrists who also specialize in wound care and foot and ankle surgery. We're going to be there with our staff to make sure that we can reach out to the communities and really educate them, especially the diabetics, who right now we're seeing a lot of influx of patients with foot infection, with chronic wounds, who during the storm really their care has been hindered. So we're going to be out there to really educate people, because there's still harmful things along their pathways, whether in their backyard and they're stepping on items that that are detrimental to their feet. So we're going to be there to educate them, to provide evaluations and just screen them and let them know how to best care for their feet.
How would you be able to, usually, you say in the past, most health fairs have like blood pressure, glucose, and your BMIs. But this is something new or interesting or intriguing to me of what you're doing for wound care for diabetics. Like, how would you be able to screen, I guess, the wounds of their feet? Like, how does that work?
Okay, so there's several risk factors that causes a patient to develop whether it's a diabetic ulcer or what we call a venous ulcer. So by evaluating a patient, immediately we can tell whether or not they're prone to getting one of those types of wounds. For example, if they're diabetic, naturally their skin will be very dry. They don't have good sensation, which is the number one risk factor for diabetics. The problem with these patients is that they always think everything is okay because they don't feel what's going on with their feet. They don't have pain, and usually most patients will, tell you that I have pain and that's why I'm here. But a diabetic will delay going to a doctor because they don't have pain. And so by evaluating those patients' feet, we can tell them if they have a condition called peripheral neuropathy, which pretty much means that their nerves are not functioning properly. And based on that, we are able to tell them that they are at risk of developing a foot ulcer. And so therefore they have to be very careful, and they have to evaluate their, check their bottom of their foot on a daily basis. We do have patients who are have difficulty in doing this, whether because they're just elderly, they can't get down there, they can't check, or they're severely obese. So, there are a lot of patients in our community that need help. And just a simple screening, we're able to tell them. We're also able to check their pulses to see if they have adequate blood flow to their lower extremities. And with that, we can tell them to say, look, do you know that by the fact that I don't feel your pulses, there could be a chance that in the future, if you do hurt your feet, your wound will not heal.
So basically, I think I'm someone who needs to pass by September 23rd. No, seriously, because, doctor, when I actually lay down on a couch too much, sometimes if my foot is in a position and I try to change it, especially if it's bent, I will have this severe cramp right there. I have it feels like a big ball that I have there. I don't know what it is, but it's scary. I just can't move. What causes that?
So that's a very common condition that everybody sometimes faces. I mean, I'm sure that I'm going to make a very common scenario where, for example, you're in a bathroom and you've been sitting there for long hours and you don't get up, and when you do get up, everybody's smiling here. You get up and you feel that tingling sensation in your legs, and you feel numb. So imagine you felt that. Diabetics live their life having those sensations constantly. But what you're describing is pretty much a nerve being compressed. You can compress a nerve for a period of time where you don't fully damage it. It can repair and it can come back where you have your normal sensation. But if such a pressure or if you encounter an injury to a nerve, sometimes it's not reversible. So again, with diabetics, the mere fact that their sugar can get out of control, the concentration of the blood sugar in your system damages the nerve over time. And at some point, they lose sensation to their feet. And they will complain of burning, tingling, numbness, feeling like they have socks on, but they don't have socks on. Or they feel like something is crawling up their leg, but there's nothing there.
Well, my biggest concern here is it's basically the cramp. It's severe. When I mean severe, I just can't move. Sometimes I cry.
So cramping is another very common chief complaint that we get from patients. And sometimes, there's several things that we have to rule out of what's causing the cramping. Sometimes mere dehydration can cause you to cramp.
That's true.
Sometimes long hours on your feet under a very cold environment can cause you to cramp. When your electrolytes, your ions in your body are not balanced properly, you can cramp up. And sometimes lack of exercise.